A vaccine can travel thousands of miles before it reaches a patient. From a laboratory to a factory, onto a plane, into a warehouse, onto a truck, and finally into a clinic. At every step of that journey, one thing has to stay constant: temperature. If it drifts too high or too low, even briefly, the vaccine can lose effectiveness. And once that happens, there is no way to fix it. It simply has to be thrown away. So how do you move something so sensitive across the world without it ever going out of range? The answer is something called the cold chain, a hidden system of storage, transport, and monitoring designed to keep vaccines within strict temperature limits from the moment they are made to the moment they are used. And it is one of the most important pieces of infrastructure in global healthcare. To understand how it works, we need to start at the beginning. Vaccines are produced in highly controlled environments. Once they are ready, they are immediately stored at specific temperatures depending on the type. Some vaccines need to be kept between 2 and 8 degrees Celsius, which is similar to a standard refrigerator. Others require freezing conditions around -20 degrees Celsius. And some, like certain mRNA vaccines, require ultra-cold storage at temperatures as low as -70 degrees Celsius. At those temperatures, even small changes can have serious consequences. That means storage is not just about keeping things cold, it is about keeping them stable. So ultra-cold freezers are designed specifically for this purpose. They are heavily insulated, precisely controlled, and constantly monitored. Inside, vaccines are stored in carefully organized trays to ensure even temperature distribution. Opening the door too often or for too long can introduce warm air, so access is tightly controlled. But storage is only the first step. Vaccines need to move. This is where the system becomes more complex. Transporting vaccines requires specialized packaging designed to maintain temperature without constant power. For ultra-cold vaccines, containers often use dry ice. Dry ice is solid carbon dioxide, and it stays extremely cold as it slowly turns into gas. This allows packages to maintain very low temperatures for extended periods. For refrigerated vaccines, insulated containers with gel packs are used instead. These containers are carefully designed to keep internal temperatures stable despite changing conditions outside. Whether the shipment is traveling by truck or plane, temperature control must continue the entire time. And that brings us to one of the most important parts of the system: monitoring. Every shipment includes temperature sensors. These sensors record temperature continuously, often every few minutes. Some systems transmit data in real time, allowing teams to track conditions as the shipment moves. If temperatures begin to drift outside the safe range, alerts are triggered immediately. This allows corrective action to be taken before the vaccines are damaged. In some cases, that might mean redirecting a shipment or replacing cooling materials. This level of monitoring ensures that every dose can be verified as safe. When vaccines arrive at a distribution center, they are not simply unloaded and stored. They are checked. Temperature records are reviewed to confirm that the cold chain has been maintained throughout the journey. If there is any uncertainty, the vaccines may be rejected. From there, vaccines are distributed again. Large shipments are broken down into smaller ones and sent to hospitals, clinics, and pharmacies. Each step requires the same level of care. Temperature control does not stop just because the distance is shorter. Even local deliveries must follow strict guidelines. At the final destination, vaccines are stored in medical-grade refrigerators or freezers. These are not the same as household units. They are designed for consistent temperature control and often include backup power systems. Even brief power outages can be a risk, so redundancy is built into the system. Healthcare workers also follow strict handling procedures. Vaccines may need to be thawed before use, but once thawed, they must be used within a specific time window. This requires careful planning and coordination. Too many doses prepared at once can lead to waste. Too few can slow down vaccination efforts. Timing matters just as much as temperature. The entire system depends on coordination. Manufacturers, logistics companies, healthcare providers, and regulatory agencies all play a role. Each part must work together to maintain the integrity of the vaccine. And this is happening at a global scale. Millions of doses moving across continents through different climates across different infrastructures. In some regions, maintaining the cold chain is especially challenging. Rural areas may have limited access to reliable electricity. Transportation infrastructure may be less developed. In these cases, additional solutions are needed. Solar-powered refrigerators, portable cooling units, and specialized transport systems are used to extend the cold chain into areas that would otherwise be difficult to reach. These innovations are critical for global vaccination efforts. Without them, many communities would not have access to essential vaccines. One of the most important lessons from recent global vaccination campaigns is just how complex and important this system is. It is not enough to develop a vaccine. It must be delivered safely, and that requires infrastructure. The cold chain is what makes that possible. It ensures that vaccines remain effective from production to injection. It reduces waste, improves reliability, and protects public health. And like many forms of hidden infrastructure, it is easy to overlook. When you receive a vaccine, you are seeing the final step of a much larger system. A system that has carefully controlled temperature across time, distance, and conditions. A system that has tracked, monitored, and verified every stage of the journey. A system designed to ensure that what you receive is safe and effective. That is how vaccine cold storage systems work. And like many of the systems that support modern life, the better they function, the less we notice them. If you enjoyed this video, make sure to like and subscribe to Hidden Infrastructure of the World. Also, comment down below what hidden infrastructure you want to see next. See you in the next video.